Welcome back. In today's video, we are going to discuss about allergic rhinitis as a continuation of our ENT series. Objectives of this session are definition, causes, predisposing factors, pathogenesis, clinical features, complications and treatment of allergic rhinitis. Allergic rhinitis is a symptomatic disorder of the nose. It is induced by an IgE-mediated inflammation after allergen exposure. It is an IgE-mediated inflammation which is caused after the allergen exposure. What are allergens? The allergens are the harmless or the neutral substances which are inhaled by the nose and they will produce the excessive immune reactions. The common examples are the pollen and the dust. Once these allergens will enter the immune system, particularly the mast cells attached to the IgE antibody, the allergen will bind to the IgE antibody which will activate the mast cells. So guys, you can see here, this is the mast cell and it is the IgE antibodies are attached to the mast cells. Once these antigens will bind here, they are going to activate the mast cells. Okay. So what happens next? Normal person, the reaction is minimum. Whereas in allergic rhinitis, these mast cells will overact and they will also signal the surrounding cells to release the histamine. Now the histamine will cause the swelling of the nasal mucosa which causes the excessive mucus production. The mucus production is blocking two pathways. One is the nasolacrimal duct. Normally, the nasolacrimal duct will drain the tears, but now it has been blocked by the mucus, so we have the watery eyes. You can see in the picture the nasolacrimal duct being blocked with the mucus, so we have watery eyes. Okay. Then we have the other pathway, the eustachian tube, which will normally drain the middle ear. Again, here it is blocked by the mucus, so we have a stuffed ear sensation. So you see from the middle ear it is draining, but then here it has been blocked by the mucus. As a result, we have the stuffiness, stuffed ear sensation. Okay, fullness of the ear during allergic rhinitis. The nerves here also get innervated. As a result, there will be sneezing. Let us revise the pathophysiology. Early phase, what happens? The allergen exposure, increased IgE by the mast cells. There is inflammatory mediators, that is histamine being released by the mast cell. It will cause the local inflammation, activate the trigeminal nerve and induce sneezing. Mucus glands which will increase the excessive mucus production which is blocking the nasolacrimal duct producing watery eyes, blocking the eustachian tube producing stuffed ear sensation. This is within 5 to 15 minutes of exposure to the allergen. In the late phase, within 4 to 6 hours of exposure, the mast cells will release interleukin 4 and interleukin 13. They cause the cell infiltration into the nasal mucosa, produce nasal edema and congestion. This is in the late phase. Interleukin 4 and 13 being released, which is producing nasal edema and congestion. Now let us move on to the next part, that is the causes of allergic rhinitis. The allergens, they are capable of making the body to produce IgE antibody. Like how we read in the pathophysiology, these allergens will enter into the immune system and they will make the body to produce IgE antibodies. The pollen, mold, dust mite. Pollens. In Delhi, helianthus, amaranthus, cassia, cenchrus, morus and imperata. You can see the picture of imperata and amaranthus. This is amaranthus and imperata. In Jaipur, we have cynodon, holoptelia and prosopis. Kolkata, argimope, cannabis and brassica. Brassica, Holoptilia has been given in the picture. In Kolkata, we have lantana, cucurbita, cassia and Coccus nucifera. You can see lantana and Coccus nucifera. Andhra Pradesh, we have cassia, ageratum, salvadora and ricinus. Ageratum, and these are the seeds of the salvadora. Bangalore, we have albizia, parthenium and artemisia. Artemisia, this plant is commonly found everywhere. Artemisia, parthenium and albizia is in Bengaluru. Now we move on to the molds. These were the pollens and the common pollens found in different states. What do the pollens do? They are capable of making the body to produce IgE antibody, and we saw the different states and their commonly found pollens. Now we move on to the molds. The common fungal spores in India are Alternaria, Curvularia, Aspergillus, Mucor, Phoma, Penicillin and Trichoderma. Fungi migrate indoor and they can cause allergic rhinitis. So guys, Mucor, Aspergillus, Alternaria, Penicillin, Trichoderma, common ones. Phoma and Curvularia have also been given. These are the these are the molds which will migrate indoors and they will cause allergic rhinitis. Now we move on to the sites of allergic rhinitis. The common sites where the fungal spores proliferate are the food storage areas, indoor house plants, leaves, soiled upholstery, garbage collection bins, damp walls, poorly maintained air conditioners, refrigerator dip pans and grain storage. So these fungal spores will proliferate in these sites. The refrigerator dip pans where the water is being collected and grain storage, air conditioners, you can see in the picture the fungus being growing there. Insects. Indoor allergens are cockroaches. Cockroaches antigens will play an important role in aggravating asthma in sensitive subjects. Indoor allergies to bedbugs, houseflies, mosquitoes and fleas have also been reported. So people who are suffering with allergic rhinitis have to see if they have all such things in their houses and try to eliminate it to reduce the allergic rhinitis. Other occupations which can be exposed to different types of insects allergens are the silk workers. They are exposed to the moth larvae and silkworm. The laboratory workers are exposed to beetles, locusts, flies and butterflies. Agricultural workers being exposed to grain mites, moths and bees. Animals. Other mammals causing sensitization among the humans are horses, rabbits, guinea pigs, monkeys and mice. These animals will contain the danger, dust, fur in them which can be a cause of allergic rhinitis. The cat danger is very light and it clings stubbornly to the clothing, to the bedding and upholstered furniture. So guys, you can see in the picture the cat danger. So it is very necessary to keep your cats very hygienic, comb them very oftenly. If in case you have the pets, it is better to keep the pets away. House dust. Dust of household origin is a complex mixture of the animals, fungi, algae, insect debris, human epithelial scales, plants and food remnants. Dust mite. It has been proved that the mites, dermatophagoids in the mattresses can sensitize the people. So even the very soft and then woolly mattresses will contain these dermatophagites, and these dermatophagites can sensitize the people and produce allergic rhinitis. In India, D. farinae is the most dominant dust mite. Thick carpets, humid 50 to 70% relative humidity, and warm 60 to 80 degree Fahrenheit climate will favor the mite growth. So these mite growths will require a humid temperature and a warm temperature of 65 to 80 degree Fahrenheit. The common reservoirs will include the bedding, mattresses, pillows, carpets, furniture, and stuffed toys. These are the common reservoirs for the mite growth. These dust mites, for them, the reservoirs are pillows, carpets, mattresses. Ingestins, which can cause the allergic rhinitis. The ingestins are especially important in the children: eggs, strawberries, nuts, or fish. In nasal allergy, it is more common to have a less obvious cause such as milk or wheat. Citrus fruits and pulses are the common allergens in most of the people. Eating a citrus fruit can cause allergic rhinitis and pulses. So as soon as a person consumes a citrus fruit, they end up with allergic rhinitis. That is nothing but the inflammation of the nose after the allergen exposure, the allergen being the citrus fruit here. Drugs, aspirin and iodides, hypotensive and other cholinergic drugs, and the insulin injections are known to cause allergy reactions. So guys, people who are taking insulin injections can also have allergic rhinitis. Aspirin, iodides, hypotensive and cholinergic drugs. The predisposing factors. Who are predisposed to get allergic rhinitis? Allergic rhinitis could be hereditary, or multiple gene interactions are also responsible for allergic phenotype. A family history of similar or allied complaints is common. So it could be hereditary, or a familial history can be found in people suffering with allergic rhinitis, or there could be multiple gene interactions. Endocrine, pubertal, marital, natal, menopausal conditions have the potential to influence the nose significantly. So guys, you can see here these endocrinal glands, these stages: pubertal stage, menopausal stage, marital, after marriage, natal, all these things have the influence to produce allergic rhinitis. They affect the nose significantly. Psychological, many psychological factors can cause the functional disorders of the nose. So you can see a person suffering with the psychological stress, like lot of depression and all such things, can also cause the disorders of the nose. One of the main etiological factor in case of vasomotor rhinitis. So it is one of the important cause in vasomotor rhinitis, that is the psychological stress. Physical, changes in the humidity, temperature, and pollution of the air can contribute to the development of allergic rhinitis. Even the humidity, temperature, and the air pollution also contributes to allergic rhinitis. Infection, viral and bacterial infection increases the permeability of the tissues to allergens. Guys, you can see these infections also increases the tissues to take up the allergen. They increase the permeability of the tissues to attract these allergens very quickly. Contacts, long time use of nasal drops or the sprays for the relief of nasal stuffiness. So people who are prone to take these nasal drops very frequently because of the nasal stuffiness, these nasal drops and the sprays will produce the adverse effect and resulting in rhinitis medicamentosa, which is another type of allergic rhinitis, which is caused by the intake of nasal sprays or the nasal drops. Penicillin and sulfa drugs, when used locally, can cause the reaction. So these sulfa drugs, when they are used, can produce the reaction being the allergic rhinitis. Irritants, fumes, example the diesel oil, pepper, tobacco smoke and pollution are also the predisposing factors for allergic rhinitis. So people having their homes nearby to the polluted areas, the fumes, the diesel oil, tobacco smoking can also be an irritant for allergic rhinitis. Now let us move on to the clinical symptoms of allergic rhinitis. Patient presents with these symptoms: nasal pruritus. Pruritus is itching. It may involve also the eyes, palate or pharynx. Nasal pruritus, and also there could be an itchy eye, itchy palate and pharynx. Paroxysms of sneezing. We saw that it is irritate histamines being released, and then it is affecting the nerves producing itching. So the paroxysms of sneezing, some patients have a tickling sensation without sneezing, while others are being exhausted with sneezing. Few people just have tickling sensation, others have severe sneezing. Rhinorrhea. This is a clear watery discharge which can be extraordinarily profuse in few people. A postnasal drip may occur, though less often than in infective rhinitis. So guys, compared to infective rhinitis, it is less in allergic rhinitis, but you can see a clear watery discharge which is extremely profuse. Bilateral nasal stuffiness. The bilateral nasal stuffiness is due to the venous stasis of the inferior turbinates and mucosal edema. Obstruction from the polyps will tend to be constant. So guys, you can see here, if this is the nose and if there is a polyp growth, the obstruction is from the polyp will be a constant factor for the allergic rhinitis. And then there is venous stasis in the inferior turbinates. So these are the turbinates of the nose. If this is the inferior turbinate, there is venous stasis of the inferior turbinate, and also there is mucosal edema. The mucosa of the nose, there is swelling, okay, there is mucosal edema. Age. Allergic rhinitis usually affects the school going children. A common sequence is eczema in infancy, then rhinitis followed by asthma. So in the infancy, the sequence is like eczema, then comes rhinitis followed by asthma. Nasal allergy is less common after the 50 years of age. Associated symptoms are: lower respiratory symptoms will include the cough, wheezing, chest tightness or dyspnea. Eyes, we have eye irritation, that is itchy eye. Skin, there is pruritus or eczematous dermatitis. Okay, in the skin there is pruritus or eczematous dermatitis. Complications are sinuses. The common manifestations are thickening of the lining mucosa, and also there is development of the polyps. The polyp could be either single or multiple in the sinuses, and the fluid effusion into the sinus can be seen. One of the complications of allergic rhinitis is it is affecting the sinuses, producing the thickening of the lining mucosa, sinusitis, and also there is development of the polyps. In the eyes, it will include the edema of the lids, congestion, cobblestone conjunctiva. You can see in the picture here, there is a cobblestone conjunctiva, allergic shinners. The allergic shinners are nothing but the dark circles under the eyes. Allergic rhinitis can produce dark circles under the eyes. And also cobblestone conjunctiva, congestion and edema of lids. In the ears, serious otitis media due to the eustachian tube block will manifest with the retracted tympanic membrane and fluctuating and conductive deafness. So guys, the eustachian tube is being blocked. As a result, the middle ear cleft, okay, which is the tympanic membrane, this collection of the pus in the middle ear cleft is nothing but otitis media, accumulation of a pus in the middle ear cleft. As a result, the tympanic membrane is being retracted, and then this eustachian tube is blocked by the mucus. As a result, there is otitis media and the tympanic membrane is retracted. People suffer from conductive and fluctuating deafness. Pharynx. Hypoplasia of the submucosal lymphoid tissue will manifest as granular pharyngitis. So people with allergic rhinitis has granular pharyngitis. What is granular pharyngitis? That is the hyperplasia of the submucosal lymphoid tissue. It is presenting as granular pharyngitis. Persistent allergic rhinitis in the children will result in adenoid facies and orthodontic problems. So guys, because of the allergic rhinitis, this child will have the mouth breathing. As a result, there is crowding of the teeth, hitched up upper lip, pinched appearance of the nose, long face. This is nothing but a typical adenoid facies, and also people suffer from orthodontic problems. Then how does the allergic rhinitis bring in complications in the larynx? It will produce the edema of the vocal cords, presenting with the hoarseness of the voice. Hoarseness results when there is a fluctuation, any alteration in the intensity of the vibrations. Okay, whenever there is some changes in the intensity or the frequency of the sound waves, it will result in hoarseness of the voice. Why is this hoarseness of the voice being produced? It is because of the edema of these vocal cords, which are responsible for the production of the sound. Whenever there is edema, it will result in hoarseness of the voice. Now let us move on to the treatment of allergic rhinitis. First, natural treatment, what we saw so far was to keep the surroundings clean, to drain the pots and then the sites where these pollens can be generated, the production, all those have to be kept clean. The house has to be dusted regularly, animals to be kept away. All such things were the natural methods how we can prevent the allergic rhinitis. Now let us move on to the actual treatment. The main treatment modalities of allergic rhinitis are the avoidance of the allergen, like how we discussed priorly, and then pharmacotherapy, immunotherapy, and local surgical intervention. Avoidance therapy, though it may not reduce the underlying immunologic sensitivity, avoidance of allergen exposure cures the clinical manifestation. Even though it will not make your system to be less reactive. The immune system is overactive in a few individuals, but then avoiding the causative factor itself can reduce the allergic rhinitis. Closing the windows and remaining in an air conditioner's environment can significantly decrease the pollen exposure. Animal danger. The patient can benefit from keeping away the pet animals. House dust mites. The mattresses and pillows should be encased in dust-proof material. You have to encase them in the dust-proof material. The bedroom should not have carpets, upholstered furniture, and stuffed animals. Make sure that there are no stuffed animals and the upholstered furniture and carpets in the room. If you have allergic rhinitis, avoid these things. And also encase the pillows and mattresses in the dust-proof material so that it is away from the house dust mites. Mold spores. Though the outdoor mold spores are unavoidable, during the certain seasonal activities like gardening and fanning, they have to be avoided. Indoor mold spores can be avoided by repairing the leaks and cleaning the mold buildup in the sinks, shower curtains, and the pipes. Drug therapy. Antihistamines. Histamine released from the mast cells by the reaction of the allergen with the IgE antibody can be effectively blocked by antihistamines. So guys, this is the mast cell. We saw the IgE antibody. After the IgE antibody, after the allergen exposure, whenever the mast cells by the reaction of allergen with the IgE antibody, they can be blocked by antihistamines. So what happens whenever the allergen is exposed to the mast cell? It is secreting histamine. This histamine, the secretion of these histamine is being blocked by the antihistamines. The examples of these antihistamines are chlorpheniramine, brompheniramine, diphenhydramine, clemastine, hydroxyzine. Drugs, the nasal decongestants. That is, these things, the oral or the topical drugs, they can remove the nasal stuffiness. The decongestants is the one which will give relief from the excessive mucus, the congestion, the stuffiness of the nose. The oral are pseudoepiphridine, phenylephrine. Topical are phenylephrine, nafoxolone, oxymetazoline, and xylometazoline. The oral drugs are pseudoepiphridine, phenylephrine. Topically, it is phenylephrine, nafoxolone, oxymetazoline, and xylometazoline. Corticosteroids, these drugs play an extremely effective role in the treatment of allergic rhinitis. It is because of their anti-inflammatory action and not an immunosuppressive action. It does not suppress the immune system to release histamines, whereas it is an anti-inflammatory reaction. It inhibits the inflammatory reaction of the nose. Rhinitis is the inflammation of the nasal mucosa. There is inflammation of the nose. What do the corticosteroids do? They will inhibit the inflammatory reaction. Mast cell stabilizers, cromolyn, nidocromil. Anticholinergic agents, the nasal topical ipratropium bromide. The anticholinergic effect of the ipratropium, it will inhibit the mucous membrane glandular secretions of the nose. So what does this ipratropium do? Ipratropium will inhibit the mucous membrane for the secretion and also the mucous membrane glandular secretion of the nose. So guys, what happens in allergic rhinitis? We saw that excessive mucus secretion will be there. Because of this excessive mucus secretion, it is blocking two pathways, the nasolacrimal duct and also the eustachian tube. What does this anticholinergic drugs do? They will inhibit the mucous membrane's glandular secretions of the nose. It is preventing the secretions of the nose. Surgery, antral washout. It is done when the allergic rhinitis is being complicated by chronic maxillary sinusitis. We saw under the complications allergic rhinitis, one of the complications was sinusitis. The chronic maxillary sinusitis being associated with allergic rhinitis, we have to go for antral washout. Sinusitis in allergic rhinitis cases will present with the exaggeration of nasal obstruction because of the nasal polyps, and there is a change in the character of rhinorrhea. Rhinorrhea is nothing but the secretion of mucus from the nose. The secretion of discharges. The discharge could be watery. From the watery, it is being turned into mucoid or the mucopurulent. And additional symptoms such as headache, hyposmia, and epistaxis, bleeding from the nose. So guys, antral washout. It is done when there is sinusitis. It will present with exaggerated nasal obstruction. There is a change in the character of rhinorrhea. From the watery, it is turning mucopurulent or mucoid. The additional symptoms were hyposmia, headache, and epistaxis. Hyposmia is the reduced smell, sensation of smell. Now you can see the antral wash in the picture. Endoscopic sinus surgery. If polyps are obstructive, they are removed with the help of endoscopic sinus surgery. The sinus operations are performed when the gross infection is present. You can see the endoscopic sinus surgery. In endoscopic sinus surgery, an endoscope is inserted into the nose. It is providing the doctor an inside view of the nose, and with the help of these, the doctor will remove the polyp. The obstruction to the nose has been removed. Cauterization. The cauterization produces fibrosis by coagulation. The cauterization could be chemical cauterization or thermal, which subsequently destroys the nerve endings. With the help of cauterization, which is nothing but the burning, what do? We are destroying the nerve endings, the blood vessels, and the mucus glands. Because of damaging the nerve endings, the symptoms of the sneezing, nasal obstruction, and they are also destroying the mucus glands. As a result, the rhinorrhea are minimized. The cauterization procedure you can see here. With the help of cauterization, they are damaging the nerves, mucus glands, and blood vessels. So the symptoms of sneezing, rhinorrhea, nasal obstruction comes down. Then the another method, surgical intervention, is septoplasty. The corrections of deviated nasal septum not only relieves the nasal obstruction, but it will also facilitate the drainage and intranasal medications. So guys, this deviated nasal septum as a complication of allergic rhinitis, this can be corrected with the help of septoplasty. Once this is relieved, the nasal obstruction has been removed and it will facilitate the drainage and intranasal medications. Inferior turbinectomy. Total inferior turbinectomy, which is the removal. They are removing the turbinate, the inferior turbinate of the nose. Total inferior turbinectomy, an effective operation for establishing the nasal airway. You can see in the picture, this inferior turbinate, it is chopped off and then it has been again establishing. This is establishing the nasal airway. It has been reshaped. This is about the deviated nasal septum. This deviated nasal septum, they have been placing the septum in a right position. And also you can see what happens here, the turbinates of the nose. This is 1, 2, 3. This is the inferior turbinate. Here 1, 2. The turbinate will be removed. The septum will be reshaped. Okay. Laser and cryosurgery. You can see in the laser and the cryosurgery, this can be done to treat the allergic rhinitis. Tonsillectomy and adenoidectomy. These tonsils and adenoids will serve as a reservoir of the microorganisms. As a result, it could be a mode of infection to the nose. They can cause allergic rhinitis, recurrent ones. So removing the adenoids and the tonsils can also help in reducing allergic rhinitis. These operations are done in children only if there are obvious evidences of recurrent or chronic infections or there is significant hypertrophy. Adenoidectomy, removal of adenoids, and tonsillectomy, removal of tonsils only when there are recurrent or chronic infections. Thank you. With this, we come to an end of allergic rhinitis. I hope everything is clear. If you have any doubts, put it in the comment section, and if you like my video, hit the like button and subscribe.